Good afternoon, everyone. I'm Don Brubaker, and we will now take you live to a Victoria County Office of Emergency Management news briefing on COVID-19.
Fire Marshal Tom Legler to address that 50% occupancy limit put in place by the governor. And then we will take some questions. A few reminders before we begin. Our hotline hours of operation changed August 27th to Monday through Friday, 1 to 5 p.m. The second update I wanted to remind everyone is election season is upon us, so please register to vote. You can do so by mail or in person. You can visit vctxelections.org. Again, that's vctxelections.org. And you can submit an application to mail or register in person at 2805 North Navarro. Again, the deadline to register to vote in this year's election is October 5th. Now, with our public health update, will be David Gonzales. I'll turn it over to you.
Good afternoon. First of all, I want to commend Victoria County residents on their strict adherence to the guidelines and recommendations that were put in place a few months ago. With the strict adherence and to the guidance and the guidelines that we've issued, we've managed to keep our daily case counts very low over the past month here in Victoria County. At this point, I'd be confident in saying the level of transmission has dropped here in Victoria County from significant now to a moderate level of transmission of COVID-19. On average, we've managed to reduce our 7-day moving average of cases from a high of 102 a day on July 20th to now a current day average of 12 as of this Saturday, the 29th. While all this is great news, we still encourage citizens to proceed with caution as we have kids returning back to school. We have social activities increasing, extracurricular activities increasing, as well as some bars and other establishments open back up that encourage close social gatherings. As for in-case investigations, the Victoria County Public Health Department EPI team has now managed to get caught up on investigations. Typically, upon receiving positive lab cases and results, we're able to complete those investigations within 1 day, with about a 2 to 3 day average of delay on receiving those lab results from the patients themselves. Now, a quick update on vaccines. As of yesterday, we received information from Dr. Scott Gottlieb, who is the former FDA commissioner. It looks like the FDA may go on to approve vaccines for select groups as early as the end of this year. But for vaccines for the general public, it looks like it may be a little later than that, possibly into next year. And with that, that's all I had. And I'd like to turn over now to Dr. McNeill to give an update.
Good afternoon, and thank you. You know, I've been looking forward to coming to a press conference where I really didn't have too much to say. And that's today. Anyway, there are just a few things I want to stress that, nationwide our cases are down, and Victoria mirrors that. Remember one time, about a month ago, Victoria was one of the worst places in the nation for COVID. So I have to tell you, just like David said, the people of Victoria have done a good job. Everywhere I go, I see masks. I see everybody in masks. And I have to think that it's not just a mandate causing that. I have to think that we're finally doing what we need to do to slow this virus. That being said, we need to remember that this virus has slowed, and we've taken our case counts down, and we've taken down our 7-day average, and we've also changed our transmission in the public to a lesser degree. So it's all working, but that's the thing. It's working because of what we're doing. We can't drop our guard. We dropped our guard before, and the cases went up. So let's not let that happen. Wear your masks, social distancing. I read a thing from the CDC earlier this afternoon. The CDC actually complimented Texas as one of the examples of how to turn a dreadful situation around. Our numbers have dropped significantly, and we're doing a lot better. But that's because we've done the work. We're wearing the masks. We're avoiding social gatherings. That was the one thing that are starting to pick up, that we're starting to see, and they're starting to see this nationwide, and we're starting to see it in Texas, is that a lot of people are starting to go to social gatherings and go to places where they socialize closely with people they don't know. I'm telling you, folks, that's still dangerous. There's still COVID out there. You've got to be careful. I can tell you there's a lot less of it out there than there was. Working in the emergency department before, it was all day long, every day. Now the cases are sporadic. The number of deaths have dropped. The number of patients in the ICU have dropped. Although we still have a lot of patients in the hospital, and we still have patients that are in very critical condition. But remember, it's the new cases we're looking at because eventually the other cases will work themselves out. So anyway, the last thing I want to mention is that we are coming up on flu season, and I'll tell you that we're already starting to see flu. And that's a little worrisome because that's early. Typically, we don't see flu in August and September as much, but especially in late August. But we're already diagnosing cases of flu. And we just kind of started checking them because these patients were coming in and they looked like they had COVID, and they were COVID negative. So we would retest them, and they're still COVID negative. So then we do a flu swab, and they have the flu. So, and that's what I was talking about the last time we met, was that we're going to see cases like this, and we're going to see patients that are sick, and we don't know exactly what it is. So flu is out there, and the best way to fight that, without a doubt, is get a flu shot. If you've never had a flu shot before in your life, I'm not sure why you wouldn't, but if you've never done it, please consider to do it this year. Remember that the national average is about 45% of the nation gets flu shots on a given year. The CDC's goal this year is 60 to 65%. We would like to get a lot more people vaccinated because that will decrease the amount of illness in our community, and it will decrease the amount of illness that confuses us as far as is it COVID or is it flu. It also frees up more space in the hospital for COVID patients that we probably will start to see again. Okay, so I'll be available for questions in just a few minutes. I want to compliment everybody that's up here because everybody's done a really wonderful job in that, and I want to compliment the city of Victoria and the residents of Victoria for doing a great job as well. Thank you. Oh, and Tom Legler is next. Yeah.
Good afternoon, and thank you. The Business Task Force for COVID-19 Education has been proactively out in the community since the orders came into place. And our goal is to educate local businesses, including restaurants, about the 50% occupancy limit. The task force has been actively inspecting all local restaurants and most other businesses as we can, including following up on complaints. At this time, we have not seen any violations of the 50% occupancy limit. We continue to encourage businesses and members of the public to remain compliant in maintaining proper social distancing and wearing masks inside the business or the facility. The task force continues to monitor and help educate businesses during this time. We thank them for the work they are doing to help educate our business. The Victoria Fire Marshal's Office continues to monitor local businesses and their response to COVID-19 requirements set forth by the governor. In addition to traditional restaurants, TABC has issued guidance for bars to change their business model to become restaurants. While the Fire Marshal's Office does not enforce TABC rules, including percentage of food and alcohol sales, we are working with the new restaurants to comply with occupant load requirements. We have often heard from concerned citizens that different restaurants are overcrowded based on their overflowing parking lots. A lot of the restaurants do not have enough parking spaces for all their seats, so they overflow into neighboring businesses and the street. The occupant loads established by the Victoria Fire Department. For those that don't know, the government orders allows restaurants to operate at 50% of their capacity, but the employees and contractors don't count. Normally on a 100% capacity that the city of Victoria issues for an occupant load, it includes contractors, it includes employees. The 50% mandate from the governor does not include those employees. So there's always that difference. There's always that challenge in that you may have an additional number of cars over the 50% or additional people over the 50% that are based on employees. Last, I'd like to clarify that there remain signs posted at local businesses that say measures were put in place due to a local order. Those signs are no longer accurate and should be considered outdated. The sign should now read, "These measures were put in place due to the state order because the mandate is acted by the governor's office and not locally." We encourage businesses to contact the Fire Marshal's Office with any questions at 361-485-34.
All right, we're having a little technical problem there, but let's give you an update on what has happened so far. The Victoria County Emergency Management News Briefing. First off, David Gonzales, the Victoria County Public Health Department Director, said the level of transmission in Victoria County has dropped from significant to moderate. That's great news. There's a current daily average of 12 new cases per day. He said in late July it was a little over 100 new cases per day, so that's a big drop. Victoria Public Health Authority Dr. John McNeill said the local cases are down, the virus growth has slowed, but he said people here cannot drop their guard, still wear masks, still do social distancing, and especially avoid social gatherings. That's according to Dr. McNeill. He said COVID is still out there, just not as much as previously. He also said they're already starting to see flu cases. We're not even out of August, and we're seeing flu cases now in Victoria County. And Dr. McNeill said very rarely does that happen, and obviously, as many people know, that is the case. Flu in August around here, that just doesn't happen, but it is happening now in Victoria County. And then Victoria Fire Marshal Thomas Legler said they continue to monitor local businesses to see how they're working under the capacity rules spelled out by Governor Greg Abbott, 50%, for example. And the Fire Marshal Legler said they are working with new restaurants on occupancy requirements. Now, we plan to have more on this story on News Center 25 at 5 and 6 and 10. So thanks for watching, and we now return you to regularly scheduled programming.